In 1994, Keith Green was in his last year of high school, excited for whatever surprises the future had in store. Maybe he'd go to college or move to a new city where he could make an impact. Green was already an active member of his community and had been spending the last few months of his high school career helping set up an annual blood drive.
Initially wasn't planning to donate blood because I was a little scared of passing out. Kind of a cool kid. I didn't want people to see that. Didn't want to ruin my reputation. So I wasn't going to donate. However, my girlfriend at the time sort of convinced me that I had to. You have to lead by example, that sort of thing. And so I did. A couple of weeks later, I got a letter from LifeSource, who was the company who done the blood drive for us, pretty much suggesting that I don't donate any more blood and that I make an appointment to come into their offices.
It was a vague letter that left way too much room for Green's imagination to run wild. He knew sickle cell anemia runs in his family. Had they detected it in his blood? After they refused to give Green any more information over the phone, he set up an appointment and hopped on the train after school.
The woman sat me down and she basically just said, "Did you know that you were HIV positive?" And of course I didn't know. I was in complete shock. I don't remember a whole lot about the rest of that interaction, right? It was very like a blur, still a blur. I don't remember a whole lot of it, but I do remember that she gave me some information, some pamphlets, stuff like that to read and review. And I just remember taking that train ride all the way back home and feeling like my life was over. You know, my very young 17-year-old life was already coming to an end.
Human immunodeficiency virus, or HIV, is an infection that weakens the immune system until patients are unable to fight off any illness. There's no cure, and though we now have various treatments to help patients keep their infection under control, that wasn't the case in 1994.
Average lifespan for people living with HIV at that time was 8 to 10 years. We didn't have all of the medications that we have now. The Lazarus effect, if you will, wasn't a thing at that time. Protease inhibitors didn't exist. So I had no real reason to believe that I'd live longer than 8 to 10 years.
Though there weren't many options, Green was able to go on 3 different drugs that he was prescribed to take a couple times a day.
And I remember that one of them was this sort of big white quarter-size chalky pill that you had to take on an empty stomach, and it tasted horrible. It was just absolutely disgusting. And I also remember just feeling lethargic, nauseous, not well. And I started taking medications around the same time that I started my first semester of college. I actually started at Columbia College. And it was just so dreadful that I just stopped.
It was a decision between Green's mental health or his medication, a choice that stretched for 8 years before his doctor made sure Green knew it was becoming a choice between life and death.
When they drew my labs, I had a T-cell count of 30, and my viral load was well into the hundreds of thousands. And so I was told at that time that, if I didn't get on medications, it was likely I wouldn't survive. I had some friends who lived here and then moved to Charlotte, North Carolina. I moved to Charlotte really because I didn't want my family to witness what I was going through. I started to lose a great deal of weight, was really sick for a period of time. So I literally went there to die.
Though he desperately needed medical care, Green says accessing it was nearly impossible without insurance.
To access the public health system there was a phone number that you had to call between 8 and 9 in the morning. That's the only time you could call to get an appointment. And generally, those appointments the available appointments for that day were gone before you got to 9 o'clock. So I had to go through several days of making an appointment. And I remember when I finally was able to get an appointment, we were a couple of months out. So it was just a nightmare trying to access healthcare in Charlotte, North Carolina.
Thankfully, a friend was able to help Green out, and he found a specialist who immediately put Green back on a treatment plan. But by this time, he had let the disease progress so far, there was still a chance he wouldn't make it.
I was hospitalized for several weeks. I'm 6'4". Average weight was at that time about 190, 195 pounds. I withered away to about 144 pounds. and was literally at one point given 6 months to a year to live.
Against all odds, Green's numbers began to turn around. Instead of a sure death sentence, he once again began imagining a possible future. The doctor handed him a copy of a magazine called Positively Aware's 2002 HIV Drug Guide, and Green began to map out his next steps.
And I kind of made a pact with myself in that moment that if I got back to Chicago, I would seek out this place because obviously there had been all of these advances in medications that I didn't know a whole lot about. And people were living, and they had information that I needed to get, so I needed to get there.
Green did eventually end up back in Chicago and worked his way up the ranks at the magazine, becoming an associate editor. He went on to become a co-founder of the Chicago Black Gay Men's Caucus, of which he is now the executive director. The organization aims to end HIV by increasing health equity and developing innovative programs. And though HIV.gov reports that cases dropped 12% between 2018 and 2022, there's still a lot of obstacles that prevention programs face. Green says a main issue is stigma. It keeps people from ever having these important conversations with their doctors.
There's still many medical professionals who don't believe in PrEP and stigmatize or shame folks for asking for it or using it. I think that there's a great deal of what we call slut shaming, where, if folks are on PrEP, they're assumed to be promiscuous. And so then that also leads to I'm not promiscuous, I don't need that, right? But any encounter could potentially put you at risk. And so it doesn't matter whether you're promiscuous or not. If you are sexually active, PrEP is something that is for you.
One of the things we know is that stigma is a big driver of why we haven't gotten to where we need to be. There's a lot of stigma, and until we end stigma, we can't end HIV.
That's Dr. Toyin Nwafor, Executive Director of U.S. HIV Medical Affairs at Gilead Sciences. She says that stigma can drastically reduce the number of people getting tested and their willingness to continue care.
If they're going into spaces where they don't feel affirmed, they feel judged, they feel like somebody sees me going to that clinic, right? So then people stop taking their meds. Stigma impacts somebody's mental health and ability to stay on therapy. If you just keep feeling like every time you take that pill, it reminds you of just how you felt the first time you got that diagnosis. So stigma is such a big part. So initiatives that normalize conversation, that normalize that we're all HIV possible, that if you're sexually active, there are ways to prevent HIV, and that nobody cares about how you're having sex and who you're having sex with. That's your personal life, and that's your personal choice. And that routinizing that conversation is what needs to happen.
If you've never gotten tested for HIV, you're part of the majority in America. Despite the CDC issuing guidelines in 2006 that everyone over age 13 should be tested at least once, only about 36% of adults have. Nwafor says part of the hesitancy has to do with how HIV testing began.
Initially, right, with the first few cases of people living with HIV diagnosed, it was thought to be only in certain risk groups, right? Men who have sex with men or injection drug use. So some of those initial testing and how healthcare providers taught was very located in certain populations. That has changed clearly over the last 3.5 decades. But it's taking people a long time to catch on, not just community, but also healthcare providers.
Nwafor says that the test has become more mainstream in certain cases. It's become a routine part of prenatal testing panels for pregnant women and for anyone wanting to take HIV preventative medication.
But there's still a big discrepancy between recommendations and what's actually happening. And there are many times when people who have been engaging in healthcare assume they've actually had an HIV test. When they go in and say, test me for everything, they assume that their healthcare provider did it already. So there's still a lot of work to be done about why it's not happening. And some of it has to do with healthcare provider bias, comfort or discomfort in having the conversation where they're practicing. And that's why the CDC took out risk-based testing and just said if people are sexually active, they should have an HIV test. And that's what's going to happen. That's the only way we're going to kind of move forward with getting it done.
Which is why Nwafor believes that many of the HIV prevention initiatives that focus on community outreach must also include the broader scope of healthcare professionals. For her and Green, the most effective message will educate the patients, doctors, and pharmaceutical companies.
You have these innovative technologies that literally could prevent someone from contracting HIV that just in 2025 still remain out of reach.
With Gilead Sciences, there's been a commitment for, 35 years now, right, to innovation in medication discovery, right? Not just in HIV, but also in viral hepatitis, right? A lot of curative therapy for hepatitis, in oncology, right? In oncology, in liver disease. But what's clear is that medications and products don't end epidemics, programs do, right? Because a medicine is only as good as getting to the right person at the right time, when they need it, how they need to use it.
Nwafor believes that public-private partnerships between HIV advocacy groups and healthcare companies are the bridge between innovation and real-life impact.
The healthcare system and partnerships within the patient community and pharma and academia and public health needs to come into play so that we can actually take interventions and actually make them tangible and real for people who need them the most.
You can find more information about Dr. Toyin Nwafor, Keith Green, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.